Well, obviously, it's great to have a drug that can improve the results from other drugs such as Afatinib. So that's obviously one important criteria that can help patients sway to decide to be prescribed Afatinib as treatment for their disease. But we have to remember that this study was underpowered for overall survival. So at the end of the day, the best information we have is based on LUX-Lung 7. So this is obviously one important information and the only information that we have at the end of the day. So it's information that needs to be shared with patients. So the decision obviously will be if we want to treat based on progression of disease or based on the toxicity of treatment. So I guess some of my patients will prefer less toxic treatment, and some patients might go for a treatment with a little longer time to progression. So we'll see. Obviously, I've had. This is an important counseling to give to patients. We have a situation where the patient can call in very early if they have significant side effects. My word of advice to patients is to use our services, call our nurses to tell them about side effects, rapidly drop the dose if they run into trouble, and when they get in contact with us, most often they're not with significant toxicity, we will reduce dose. Of course, Afatinib is manageable. Patients can reduce dose and get into a better tolerance profile. So obviously, for patients that are keen on using Afatinib to treat their disease, there certainly is a way to get around toxicity. I personally have big issues on quality of life data. From my own experience, there is certainly quality of life differences based on toxicity. So on one hand, side effects from Afatinib will be an issue for certain patients. And obviously, if you have a regimen such as Afatinib that leads to earlier progression, there will be quality of life issues related to progression. So that's two sides of a medal. Patients can actually decide and help us make that decision in the clinic as to whether regimen should be used. Once again, dose reduction leads to better tolerance. So I don't know how we can actually interpret your comments, but I would think obviously that if you find the right dose for a patient, you will get the best quality of life for him.